What is an educational therapist and how does it differ from tutors? Oftentimes, honestly, parents, educators, and teachers or professionals don't know what an educational therapist is. Coming from a teaching background myself, I actually did not even know what an educational therapist was or that this field existed until I started working with an educational therapist that was supporting students in my classroom. And I really, this is how I got curious in being an educational therapist because I noticed the profound impact she was having. And her name was Lisa Hillman. She was an amazing mentor to me, but she was having such a profound impact on our students, on our families, and was really making a change in their life. It was very different from any support that I'd seen any of the tutors give, and something that I had never heard of. And if you go online now, actually, even I know in California, in Boston, in the more populated states, I'd say this field is much more known. But in other states, this field is really not yet known. And it's slowly starting to make more noise, and more master educators are joining the field. So that's really exciting news. But yes, it's something that we are continuing as educational therapists. We really want to continue to bring this out to the population so that we can give the students the support they need, match them with a qualified educational therapist when they need it, and also match them with a coach when they need it. It's important for teachers, professionals, and parents to know when their child needs an educational therapist versus a coach. The Child Mind Institute defines an educational therapist as a professional who is trained to understand an individual's learning challenges and the patterns and behaviors that they have developed to work around or mask their deficits. So really, this is a fancy way of really saying that educational therapists are well versed in reading, understanding the child's cognitive processes, understanding reports, and considering all factors that could be coming in the way of this child's learning and their performance. So as educational therapists don't just look at the academic skills and the gaps in the student's learning, right? So we are not here to just say, okay, they're really struggling with their math facts, or they do not know how to structure and organize their paragraphs. We are looking at all facets of this student's life to build a comprehensive profile of the student's performance, their learning needs, their learning profile, their strengths, their challenges, and everything else that could be impacting them. So some factors that we consider that, requires the person working with them to really get to know the child is, what does their sleep hygiene look like? Are they getting enough sleep? What's their diet look like? What's their social connections like, right? Are they spending time doing the things that they love with people who bring them joy? We know how much that impacts mental health, which impacts the child's ability to learn and function in the classroom. We're also looking at the exercise that they're doing, how much unstructured time they have. Sometimes we see students who are really overpacked and overscheduled, and that impacts their sleep, creates sleep deprivation, which impacts their learning, right? So all of these factors have a cascading effect into different areas of their life. And so as educational therapists, it's our responsibility to look at not just what we're seeing here in session and what we get from teacher notes and parent conversations, but also what are we noticing, or what is the child telling us that needs to be considered in order for this child to have a healthy state of mind and be able to learn in our session and outside of our session, and also get by with their day-to-day routines. Because again, as most tutors, and tutors, there are some tutors out there, every tutor out there is great. We all have the same intention in mind, which is to really make learning easier for the child, right? How do we support the child? However, as educational therapists, we really consider everything that's going on for this child. So what are the, where are all the challenges stemming from? right? So we can get to, helping this child understand their algebra or helping this child with their executive function skills. But if we're not understanding where all these challenges are stemming from or what's been, their pathway in getting to where they're at now, then we're not targeting the root cause of the issue, right? We're just putting a band-aid on something. So we're fixing one thing, but that where this issue is stemming from is going to cause an issue in a different way. So, we're taking really proactive approach to all of this and considering let's fix not fix, but let's support the child in meeting these learning gaps and their learning skills here, but also address where all of these challenges are stemming from so that it impacts other areas of their life and continues helping them in the future. So we work with a range of backgrounds. We work with students who have autism, those with dyslexia, dysgraphia, dyscalculia, ADHD, other health impairments, test anxiety, perfectionistic tendencies, all trauma, right? We work with students who come from a very diverse background. And then we focus on seeing the whole child. Again, their emotional aspects, cognitive processes, and all of that we consider helps us create a treatment plan or begins to help us create a learning profile to really build a comprehensive view of this child to then be able to provide them with the support and strategies that this child needs. So everything, all the support and the strategies and the evidence-based strategies that we use are all personalized based off what we know about this child. Okay, so we are not taking curriculum from anything. We are building everything, personalizing it in a way that matches the child's learning profile. So it really requires someone to be well versed in all these different areas, understand the cognitive processes, and then be able to analyze to then come up with applied strategies and figure out what's the intervention that this child needs. In within all of that, we are always in talks with communicating with teachers, parents, and their whole team, which includes neuropsychologists, therapists, speech pathologists, and more. A big role, something that we really do, is we analyze the reports that we get. So sometimes, not all the time, but often, students come to us with neuropsychological reports and psychoed reports that are either, that they've been privately done or that the school has provided through their IEP or testing. And so we take those reports and again, we analyze what are the battery of assessments that the assessor used. Why did they choose the battery of assessment? What was the reason for the child being referred to be assessed? What has been the developmental history of the child? And then we start analyzing the reports. We're really trying to figure out, okay, what are patterns of behavior and skills that we're noticing, right? Looking at the subtest. So any discrepancies in the test results, we're looking at why was this child, how did they perform so well and get this test result here, and then in this other test result, which should have matched it, it did not match it, right? So we're really teasing through the discrepancies in the test results. We're looking, again, figuring out what are the strengths that this child has so that we can harness these strengths, teach the child about these strengths, and then begin to implement them in areas that are much more challenging for the child. So some of these tests will include cognitive ability tests, such as the WISC, and achievement tests such as the Wyatt, executive function surveys, questionnaires, interviews with the parents, teachers, and other people involved, and report cards. So it's a lot of information gathering to really understand the child. Then from there, we also do our own assessments, right? So we know that the test that has been done for this child was the way the child was functioning, performing at that time of testing. However, a lot of things could have impacted the child's results. The child could have been sleep deprived, they could have been hungry, they could have been stressed at the time. So there are lots of things that could have impacted this child at that moment. In addition, often students will do better if it's just in a one-on-one setting with in an enclosed and a structured environment, right? So we want to get a complete picture. What's happening outside of the session? How is a child performing typically? What are others noticing that was not brought up in the test results? So, that's when we go outside and we start scheduling meetings with therapists, with their teachers, asking parents more detailed information and questions. And then also from there, we start figuring out, okay, well, we know the child is struggling in X, Y, and Z. Let's figure out what type of assessment we need to do to be able to really pinpoint academic skills. And in addition, address other skills, not non-academic related, that are impacting the child. So it could be their, such as their perspective on something, or have test anxiety, or stress tolerance, right? There are different things that we tackle and address as well that support the child to meet the academic skills. So the test results really just give us a guiding light. They're really helpful, and we often refer families to get these assessments. So we, have neuropsychologists and other professionals who we trust and who we think write really good, thorough reports. And so those are the assessors that we typically refer families to. So again, we're looking at all of these tests. We're trained in reading the subtest, and then from there creating our own, extracting information from them to begin to create a treatment plan. So for example, oftentimes students are tested for their visual spatial skills. Well, there are different subtests that neuropsychologists will do to really get a complete picture of what their visual spatial skills are like. And so from there, we can figure out what's their visual motor skills, how are they seeing visual spatial relationships? How are they recognizing part wholes? What's their problem solving skills like, and their visual spatial integration, right? So we're looking at each subtest and analyzing everything, and then figuring out, okay, these are the strengths of the child, and this could be reasons why this child is struggling in this different area. In terms of training, an educational therapist will go through and get an educational therapy certificate. But in that certificate, it's really teaching us how to read reports, create reports, how to support the child comprehensively, understand cognitive profiles, not just learning disabilities or learning differences, but really understanding, how the brain is wired and how different processes impact performance. And then each educational therapist will typically specialize in a couple of areas. So there are specialists that will specialize in dyslexia. And so, they are trained in Orton Gillingham or in a Wilson program. So, trained in evidence-based programs and strategies to be able to teach to the student in the way that the student needs to be taught, right? Here at We Thrive Learning, we typically we support students in 4th grade all the way to college, and we specialize in supporting math. So we use base 10 blocks to teach our math, ADHD, executive function skills, and study skills, and then older students, written language processing. So reading with older students, reading comprehension, note-taking skills, auditory processing, written expression, written language retrieval, anything that's required or that the student needs to process language well. So again, it's all 4th grade to grad school, and we specialize in ADHD, executive function, language processing, and math or dyscalculia. And then we refer students out. So, if we're noticing something in here, we start building evidence or a case for reasons why we think it would be helpful for the student to get assessed or evaluated by a different specialist. So, sometimes we refer students to audiologists or speech pathologists. ETs that typically work with the younger students will refer them to OTs if we're noticing fine motor skill difficulties, right? So there, we also tell families like, hey, we feel like there's a need for us to seek an additional or rule out a diagnosis. And so we give them a list of referrals that we know that specialize and can support and assess the child. And then, so we work beyond sessions with students. So, our sessions don't stop just in the time frame that we're with them, right? Our goal as educational therapists is for our students to thrive outside of session with us, and honestly, for them to graduate from the support that we have, right? So we are, their success is our success. As soon as students are able to graduate from their support, it means that we have met their needs, right? That they've learned the skills to be able to meet the demands of school and function in life how they want, how they expect to. It's our job to make learning and life easier for them and help them live a happier life. That's always what we tell our students. And so outside of sessions, we are advocating for our students, right? So we are telling, meeting with teachers, meeting with other professionals, sending parents and scheduling meetings with parents to let them know what we're observing here in session, strategies that are working, accommodations that we think could be helpful for the family, for the school to provide the student with, assistive technology that we think could be helpful, right? Again, we are creating goals and treatment plans, and these are constantly changing. We take thorough session notes, clinical notes, to be able to guide every session afterwards, to be able to document progress, be able to share with families the growth, observations that, again, we're noticing. So we start building a case for the student. We track and monitor progress, we assess, ask students for input back on our support so that we can enhance it and make sure that we're meeting their needs from their perspective. And we support families in creating structures that are conducive for the child's learning, right? So we're getting into what does their desk space look like, what's going on in the house, or what's this child experiencing that we think is helpful for the family to know. So we're constantly in chats with our parents so that any strategies that any strategies that would be helpful for them to know are shared so that they can be applied at home and we can accelerate the growth and the progress of their child. So we are working in conjunction with parents all the time so that the student can experience the most, results and see progress quickly. And then for the students, I think this is, this is the best part of the job of our work here. It's witnessing the growth that the students have. So students are learning strategies that allow them to, strategies that level out the playing field for them. So it allows them to learn in a way, what's being taught in the classroom. So typically in the classroom, teachers are teaching in a way that's, is meant to meet most of the needs of the students in that classroom. Students with learning differences require different modality of teaching, right? So their brain is just wired a little bit differently, has nothing to do with their intellect. It just means that they need the teaching to be done differently. And so that's where we step in and we can help the student figure out, we've helped them realize what way they need to learn specific content, right? So that they can access the learning. And so, whichever way the teacher is presenting it, the student can then tweak it or use tools and strategies that we've taught to be able to make it so that it's accessible for them. And that's truly transformative because this is what they take into their college years and when they start working in the work field. We are also building problem-solving skills. We are raising awareness so the students who work with us really get to know themselves, right? So I'm not just saying like, this is what I like, this is what I don't like. No, we're raising their self-awareness. What tends to come in the way? They begin to hear our coaching when we're not around them because we're asking the same questions for them, right? So that they can begin to take a much more meta view of themselves, a bird's eye view of themselves to think about and evaluate their approach, their strategy, and what they need to be successful. They know the strategies that work for them. They know the tools and the assistive technology that they need to be able to learn. And so they are asking for this for their teachers and their colleges we are working with them, rehearsing how to have conversations with them so that they can ask for the support that they need. As soon as a student is developmentally appropriate, which starts around, fourth, higher, upper elementary, we are beginning to coach the students on how they can begin to advocate for themselves. We are recommending for students to join and schedule meetings with their teachers, to be a part of the conversations that their parents are having, so that they begin to build the skills that they need to be able to advocate for themselves outside and into college. Right? They learn how to navigate the resources available, the assistive technology, who to ask for help, when to ask for help, and how to ask them for help. Right? So they are really understanding how they can, all the resources that are available to them and how they can access them. We are and because of that, they see progress and their confidence skyrockets and their self-esteem soars. And what happens out of all of this, because everything becomes easier for them and they begin to see the progress and their growth, they're much more calmer. And because they're much more calmer, they have a sense of control over their lives, know what to do without getting all frazzled, right? It has a cascading effect into how the rest of the family experiences. So when one family member thrives, it impacts the whole family and every family member thrives, right? So when parents are witnessing the growth and the transformation, then their students becoming much more independent and taking much more ownership over their responsibilities, it really creates a calmer household, restores parent and family relationships with their child, and really makes it so that everyone in the house feels less frustrated, less calm, and there are less arguments and battles at home. So it's just a byproduct of the support that the student receives. The family experiences all of this as well. In fact, recently we got we love getting our videos and testimonials from our families, but we get pictures of how our students are doing, them participating in sports or in piano or things that they would have never participated before. And not that the parents credit that to us, but really it's their child that is making all of their trusting us and implementing the strategies. And then when they're seeing growth, it really starts to help them reframe their perspective on themselves. So they learn to advocate for themselves. They learn to ask for and accept help. This is something that we also really model for parents to do. And they learn how to be resourceful, right? Again, they are used to all navigating the resources. They are really adept at knowing what sort of assistive technology and accommodations they need. And then they begin to advocate for themselves and, ask for what they need. And it fosters flexibility and resilience. So a big part of the work that we do is really stretching, right? Their flexibility muscles, changing their perspectives on how they view things, oftentimes their teachers, or how to ask for support, and then helping them evaluate, without us telling them, they begin to evaluate things that are coming in their way of their success. So we build such an intimate relationship with our students. We get to know them at a level that is unmatched, I'd say. We're really there as their mentor, their coach, their teacher, their friend, everything. And they stay with us. So we have students that have been with us for 6 years, students who have gone off to college, students that are going to college, students that come and go, and the relationships that we form with them are meaningful and lasting.